Good evening and welcome to the Lung News Network. I'm CK. Tonight we are reporting on a silent but serious lung disease, emphysema, a condition that affects millions, often without them even knowing it. In this program, we'll explore 5 key questions. How do healthy lungs work? What happens in emphysema? What causes it? How do doctors diagnose it? And how is it treated? Let's begin by understanding how healthy lungs work. For that, we go live to Dr. Goh at the Respiratory Research Lab.
Thanks, CK. I'm here at the Respiratory Research Lab to explain how healthy lungs work. Our lungs are like stretchy balloons. When we breathe in, the diaphragm, which is the muscle below the lungs, moves down, creating space and pulling in air. When we breathe out, the diaphragm moves back up, the lungs shrink, and we push out carbon dioxide, the waste gas. This happens about 12 to 20 times a minute even when we are resting. Now inside the lungs are millions of tiny air sacs called alveoli. They are surrounded by tiny blood vessels. These thin wall sacs let oxygen move into the blood and carbon dioxide move up. This gas exchange keeps us alive and energized all day long. But what happens when these alveoli get damaged? That's where emphysema comes in, and we'll explore that next.
Let's talk about what happens in the body of a patient with emphysema. First, the destruction of alveolar walls. With emphysema, enzymes like elastase destroy the walls between alveoli. This leaves fewer, larger and stiffer air sacs, which means less surface area for gas exchange. Second, the lungs lose their elasticity. Healthy lungs bounce back after each breath, helping push air out. But in emphysema, this recoil is weakened, so air gets trapped, making it harder to fully exhale and causing the lungs to overinflate. Finally, even though emphysema doesn't cause airway inflammation like chronic bronchitis, it still leads to airflow limitation. That's because the small airways collapse during exhalation.
What causes emphysema? Is it because of marijuana? Is it because of cigarette smoke? Or even air pollution? The answer is, all of them can cause emphysema. While cigarette smoke is the main cause of emphysema. What happens when your lungs are exposed to harmful irritants every day? The chemical substance in one single cigarette can destroy alveoli and block airflow. But it's not just about cigarettes. Other factors such as marijuana, vaping, secondhand smoke, dust, and even cooking with firewood can contribute to emphysema. Other than that, genetic causes of emphysema are age, family history, and rare genetic disorder like alpha-1 antitrypsin deficiency. This protein helps to protect lungs from irritation and blocking the effect of powerful enzyme called elastase. Without alpha-1 antitrypsin, elastase can destroy the alveolus in the lungs, causing emphysema.
Emphysema is a chronic lung condition that affects the air sacs or alveoli, making it harder to breathe. But how is this condition diagnosed? Diagnosis starts with a detailed medical history. Doctor asks about smoking habits, exposure to dust or chemicals, and any symptoms like shortness of breath or chronic cough. The next step is pulmonary function test, also known as spirometry. This test measures how much air you can exhale and how fast you can breathe out. In emphysema, the results often show obstructed airflow, especially a reduced FEV1 FVC ratio. A high-resolution CT scan can show areas of lung damage, enlarged airspace called bullae, and loss of lung tissue. This is often the most definitive tool to confirm the type of emphysema. In some cases, especially in younger patients or non-smokers, a blood test may be done to check for alpha-1 antitrypsin deficiency, a real genetic form of emphysema.
Lastly, let's see the treatment for emphysema. Before this, we have to know one question. Can your lungs heal from emphysema? The answer is no. The treatments can only help to reduce your symptoms, improve your quality of life, and help to prevent the future damage from occurring. Firstly, inhaler with medication such as bronchodilator and inhaled corticosteroid are used for emphysema. The bronchodilator helps to relax the muscle around the airways, while the inhaled corticosteroid helps to reduce the inflammation and mucus production in the airways. Besides that, if the lungs are not getting enough oxygen, the oxygen therapy may be needed for the patient. They can get extra oxygen to their lungs through a mask or plastic tubing with tips that fit into their nose. And these are attached to an oxygen tank and they are lightweight and portable. In severe and serious cases, operations like lung volume reduction surgery or even lung transplant are required. In lung volume reduction surgery, the surgeon will remove the wedges of damaged lung tissue to improve the lung function. And for the lung transplant, this is not recommended because it has serious risks such as organ reaction that is fatal.